You hear a doctor talking to a patient who's been having trouble with his water. Now read the question.
You can get dressed now. Well, Mr. Hartley, I think your problem is due to the fact that the kidneys are not working as well as they should be. Have you ever had trouble with your water before?
Well, yes. A couple of years ago I had burning when I passed water. The GP said I had high blood pressure and he put me on tablets and it cleared up for a while. So what now?
Well, I want you to have some blood tests, x-rays and kidney function tests. I want you to collect your urine for 24 hours. Nurse will tell you exactly how to do it. Then we'll ask you to come in for an ultrasound examination of the kidneys. This is a very simple procedure to make sure there is no obstruction.
You hear a nurse briefing her colleague about a patient. Now read the question.
Our sickest patient is AJ. AJ is a 6-year-old boy who was admitted with hypoxia and respiratory distress secondary to a left lower lobe pneumonia. He presented with cough and high fevers for 2 days before admission, and on the day he presented to the emergency department, he had worsening respiratory distress. In the emergency department, he was found to have a sodium level of 130, likely secondary to volume depletion versus syndrome of inappropriate secretion of antidiuretic hormone. He received a fluid bolus and was started on oxygen at 2.5 liters. He's on ceftriaxone. Please look in on him at approximately midnight and make sure his vitals are unchanged and his oxygen saturation is stable. Also, check to determine if his blood culture is positive tonight. If his respiratory status worsens, please get another chest radiograph to determine if he is developing an infusion.
Listening, Part B. You hear part of a consultation at a GP practice with a patient suffering from depression and sleep disturbances. Now, read the question.
Because there are better ways for the patient to respond.
Well, Brian, at the Belmont Private Hospital, they have a CBT program, which stands for Cognitive Behavioural Therapy. It focuses on changing your thinking patterns and the way you respond to challenging situations.
I see.
It will give you the skills and knowledge to help you achieve more control of your emotions and feel better about yourself and your life.
Well, that does sound like it could be a good thing for me.
Other topics CBT deals with include anger management, coping with change, as well as things like setting goals and assertiveness training.
Right.
Alright, Brian, I'll book you in. It's a 3-week course every day from 9 a.m. until 3 p.m. Now, I would like you to take the antidepressant medication one at night an hour before you go to bed. You can still take the Normazine if you are having any trouble sleeping.
Okay, well I'll do that.
The most important thing is to talk about how you're feeling, and don't hesitate to call me if you are having any problems with the medication.
Listening Part B. You hear a nurse speaking on the telephone to a doctor about one of their patients. Now, read the question.
Hi, Dr. Jones. This is Helen from the PA hospital. I'm calling about your patient, Mrs. Singh, in room 231. She's a 70-year-old second-day post-op hip patient. and she's been complaining of intense pain tonight. She received all her scheduled antibiotics, but started running a fever of 38.3 degrees at midnight. Her incision is also quite red, and I noticed some new purulent drainage. I'm concerned she may have an infection, and I'd like you to see Mrs. Singh as soon as possible. But in the meantime, I'm wondering what course of action you'd like me to take, whether or not you'd like me to draw a CBC or blood cultures.
Why did
Listening Part B. You hear the principal of an aged care home talking to staff about osteoporosis. Now read the question.
I wanted to finish up by talking to you about osteoporosis. The age of a lot of our residents means that they are at risk of developing the disease. Genetics and lifestyle factors play a part, but not getting enough calcium and vitamin D can make the condition worse. So I'd like you to ensure that the needs of our residents are being met in this regard. Also, and this may be a significant factor for some of our residents, corticosteroids may contribute to the onset of the disease. For residents who already have osteoporosis, there are medications available to help, including Fosamax, Boniva, Actonel, and Reclast. These drugs work by increasing bone density, so they can help reduce the risk of fractures. Now, there are also treatments available specifically for men, which wasn't the case in the past. And as you know, some of our male residents can be resistant to taking medication. So I'd really like you to mention this to them.
Listening Part B. You hear two nurses discussing a patient, Mrs. Robbins. Now read the question.
Hey Kylie, can I talk to you for a minute about Mrs. Robbins in room 225?
Sure, what's happening?
Well, she's Dr. Newen's patient, and his notes say that she needs to start mobilising today and that her discharge is planned for the day after tomorrow. So I checked in on her and asked her how she was feeling and let her know that I'd take her for a shower. She's been getting a wash in bed until now.
Okay.
The thing is, the moment I mentioned the shower to her, she started getting really upset and then said that she just wanted to rest. And I tried explaining how important it was for her to mobilise and that it was the doctor who had ordered it and that it would help speed up her recovery, but she wasn't having any of it. She told me she'd speak to Dr. Newen herself and that she wouldn't listen to me because I was only the nurse. I didn't want to make her any more upset than she already was, so I just left it, but now I don't know what to do.